Hi guys, are we ready to get started?
Yes, we're ready.
Okay, perfect. Thanks everyone for joining us today for what's going to be a really interesting webinar on navigating the egg donor and surrogacy process. We know it can initially be an overwhelming process for potential parents. So to help answer any questions you have, we've got two experts in the field sharing their knowledge and their experience with us today.
We have Dr. Saeed Danishman. He is a specialty board certified gynecologist with a subspecialty in reproductive endocrinology. He serves on the board.
I'm sorry, I think we need to see the screen that has Dr. Danishman's.
There we go.
Sure.
Yes.
I recognize that man.
He serves on the board of several surrogacy advocacy groups. He has collaborated to develop IVF protocols to improve pregnancy rates, including PTEC, post-thaw extended culture, which is one of the most successful IVF regimens currently available. Parham Zar is the founder of Egg Donor Surrogacy Institute. Parham has helped thousands of intended parents bring their dreams of parenthood to fruition with over 20 years working in the field. He carries a vast amount of knowledge in the field in regards to reproductive challenges, reproductive laws and rights, and third-party reproductive options.
Oops. So as we go along, there'll be an opportunity to pop any questions you might have in the chat. We love getting questions, so go for it. And I think what might be a nice starting point is if we could have you touch briefly on what the egg donation and surrogacy process is, and what's the difference between each of those.
Absolutely. Do you Parham, do you want to start? Do you want me to start? Or
I want you to go ahead and start, please.
Sounds good. Absolutely. So I'm Dr. Saeed Danishman. It's really an honor and a pleasure to be with you. For the past 23 years of my career, I've had the honor of helping many intended parents create their families with wonderful partners such as EDSI. So I always like to think of the journey in three parts. You know, you have the sperm, you have the egg donor, and you have the surrogate. The first initial sort of foray into your journey to becoming parents is to get some initial diagnostic testing done. Now, some of you are going to be using a sperm donor, some of you are going to be using an egg donor, some of you are going to be using a surrogate. So we want to get an assessment of the sperm quality. We want to get an assessment of the egg quality. And certainly if you're using an egg donor, the egg donor goes through several screening examinations and tests in order to ensure her genetic health and the quality of her eggs in her ovaries. On the sperm parameter side, we want to make sure we look at the concentration, the motility, the morphology, all of these parameters are going to ensure a successful IVF cycle and the creation of healthy embryos. So that's the sperm side. Now, many of you live sort of away from California in different states and different countries. And what I wanted to let you know is the good news is that we have many collaborators across the US and across Europe and Australia where we can freeze the sperm and then transport the sperm over to us for the creation of your embryos. And that's something that we certainly will talk about in terms of our collaborations for monitoring, for freezing sperm, for doing the FDA testing. In regards to the egg donor, for those of you who are using an egg donor in order to be able to create your families, we work with our partners such as EDSI to find the ideal egg donor. And the ideal egg donor is in her 20s, somebody who's healthy, somebody who doesn't have any significant genetic mutations. We look at her family history. We want to make sure that she doesn't have any potential risk factors for the transmission of any diseases that we're seeing potentially in her family. So there are a series of tests that we perform on the egg donor, including a psychological examination to ensure her mental health, a genetic examination to look at recessive mutations and ensure genetic compatibility with the sperm. And these are recessive mutations such as cystic fibrosis, thalassemia, sickle cell. We look at egg quality parameters because we want to ensure that your egg donor has a good supply of good quality, healthy eggs. And that's done by assessing some hormone levels, anti-Müllerian hormone, cycle day 3 FSH, estradiol. In fact, we've published many papers over the years looking at tests to assess the quality and quantity of eggs in the ovaries. And then we also want to make sure that your donor has a consultation with our genetics counselor. Our genetic counselor goes over a detailed history of her family, again, to ensure there are no red flags in regards to the transmission of genetically linked diseases. Once your egg donor completes her screening process, and once the legal contracts are completed, and as you know, some egg donors are known egg donors, some are semi-known, which means that your children have the right to contact the egg donors, and some are anonymous. Once that portion of the legal contracts is completed, then we can start to create the embryos. And your egg donor takes medications for about 10 to 12 days. These are the same hormones that the brain produces each month to mature and develop eggs in the ovaries. Every egg develops in a little cyst called a follicle. And what happens is during those 10 to 12 days, we monitor very closely the production and the development of those follicles and eggs with your egg donor. Once those follicles get to reach a certain size and diameter, that's an indication that the eggs are mature. We then non-surgically retrieve the eggs. And then what we do is we thaw the sperm samples, because by this time we would have had your sperm sample frozen in our lab or transported frozen to our lab. And the sperm then goes through 2 particular protocols, because as you know, in order to create healthy, good quality embryos, we need the best quality eggs and the best quality sperm. So how do we select the best quality sperm? We have 2 protocols by which we can select out the best quality sperm based on DNA integrity and health. The first is something called microfluidics or zymote. And for many, many years, we used to look at sperm under the microscope and individually select the ones that were good quality based on their progressive motility, based on their shape, their morphology. But now we have one further step prior to that, and that is the zymote microfluidics. Think of it as almost like an obstacle course for the sperm. And based on the research that's been published and the studies and research that we've done, we found that the sperm that complete the obstacle course have lesser levels of DNA fragmentation and thus better quality DNA. So the sperm go through that particular microfluidics zymote course. A small percentage of those sperm actually complete the course, and from there we are selecting individual sperm and injecting individual sperm inside the eggs. Then what happens is we really look at the embryos and monitor the embryos' development over the course of the next 5-6 days. And in fact, what I'd like to do is show you images of the embryos as they develop. So here is an egg. And essentially, we can assess the maturity of the egg, but we have limited assessment as to the quality of the egg, because we really have to fertilize the egg in order to assess its true quality and viability and potential. So after the injection of the sperm, you have these 2 nuclei. So you have a fertilized egg. And then after that, the embryos start developing and dividing into 2 cells, into 4, into 8. And after 5 to 6 days, they develop into a stage called a blastocyst. And it's at this particular stage where the embryo is either frozen, or this is the stage at which we do the chromosome analysis to determine the presence of chromosomal abnormalities such as Down syndrome. That particular test is called PGTA. We can also determine the presence of other genetic abnormalities within the embryo. In other words, if, for example, for some patients, if they carry and share particular genetic mutations or translocations, these are DNA breaks with the chromosomes, we can test those, create probes and test those with the embryos. Once the embryo is assessed for chromosomal, in other words, once it's biopsied, then we freeze the embryos for future transfer. And there's no difference, and we've published many papers on comparing fresh versus frozen embryo transfers, no statistical difference between the 2. So now we have a group of embryos that are going to be frozen. At this particular time, we wait for the genetic results, the chromosomal analysis results. And once we have those, we have another consultation together to review the quality based on cell structure and also the chromosomal results. Now, the classification of embryos that we have is based on the quality of the cells. There are two types of cells we look at. One is the inner cell mass, and I'll show you this image again. So the inner cell mass is this group of cells right here, this sort of cohesive, compacted group of cells that give rise to the fetus. And then you have these other trophectoderm cells, which are essentially the group of cells that give rise to the placenta and gestational sac. We have a classification system. It's based on papers that we published over many years. In fact, our classification system is used by many fertility clinics to assess the quality of the embryos, and it gives us precision in determining the rate of pregnancy and rate of live birth. And the classification is based on A, B, and C, A being the best quality in terms of cell structure. We have a review
sorry,
of—
Dr. Donishman, I'm
Yes.
so sorry to interrupt. I just wanted, you are giving such a beautiful,
Sure.
detailed explanation.
Right.
And it's
I'm
so
just-
much
I'm the- like,
information.
yeah.
But I wanted to kind of interrupt real quick because I do want to have Parham to answer this part quickly
Absolutely,
as
absolutely.
well. And then we can kind of continue on this whole
Absolutely.
journey, because I know everybody here, because we're getting messages about it, are very intrigued. And I love the photos you're showing as well.
Absolutely.
Parham, should we ask the question again, or do you know?
Sure. Well, you know, Dr. Donishman does such an amazing job explaining it. You know, when we're looking at egg donation, surrogacy, the criteria, you know, the thing to consider is that the physician ultimately has a say in who is a good donor and who is a good surrogate for us. However, the focus of the physician is on certain things. The focus of the intended parents is on other things. So for example, the intended parents might be thinking about the physical aspect of an egg donor, or you know, whether the education or what they like or what they don't like. And also for the surrogate, they might be thinking, who is a surrogate? Will she be eating healthy? Is she going to take care of her pregnancy? There is no drugs, there is no alcohol. More personal concerns. The doctor has medical concerns in addition to all of these. And of course, we as agencies want to make sure that nobody has any headaches. So we want to make sure that we have an egg donor or a surrogate who have the right temperament, who have the right mindset. The psychological aspect of it is very important. So these are all different things that, you know, we all focus on different aspects of who is a good donor and who is a good surrogate.
Great.
I know we have a lot of questions here.
We
so-
do. We have a lot of questions. But we want to go through a few more and then we can open it up to everybody else. So what are the different types of surrogacy? Can you explain the difference between gestational and traditional surrogacy?
So yes, from a medical perspective, traditional surrogacy is where the surrogate is also contributing her own genetics, meaning that we're using the surrogate's own eggs in order to be able to generate a pregnancy, create a pregnancy. Now, typically, traditional surrogacy is something that's more complicated from a psychological perspective, from a legal perspective, and we really don't do traditional surrogacy here at our clinic. Gestational surrogacy is where the genetics, in other words, the eggs are coming from an egg donor or an egg provider, and there is no genetic link between the surrogate and the egg provider or the egg donor. So that's a gestational surrogacy. Differs from traditional based on the fact that in traditional, the eggs are also coming and the genetics are coming from the surrogate. So there's that genetic link between the surrogate and the fetus.
And one thing to note is that most, probably over 95% of all surrogacy cases, at least within the United States, are gestational surrogacy, where the surrogate does not have a genetic link to the baby.
Exactly.
So most of the cases that we do, that's the case. The source of the egg is either the intended mother or an egg donor.
Okay, wonderful. And on that note, can you speak a little bit on the expenses involved in the process in egg donation and surrogacy?
I can tell you, I mean, I can kind of give you a rundown of the things that are involved. Of course, your physician will be doing the IVF, the in vitro fertilization, all of the medical screening for your egg donor or for your surrogate or for yourself. So you have the costs of the screening and in vitro fertilization. There is the cost of the medications. Then you are looking at the other costs, including the egg donor compensation, surrogate compensation, the legal aspect of it. You will have an attorney that will be representing you, and the surrogate will have an attorney that will be representing the surrogate. The egg donor will have an attorney that will represent the egg donor. There is the costs of the court system in order to get a pre-birth judgment before the birth of the baby, to place the intended parents' names on the birth certificate. There is psychological screening, the costs of the OB care for the surrogate. Dr. Danishmand will typically, correct me if I'm wrong, but you will, Dr. Danishmand, follow a surrogate pregnancy through about 10 weeks, right? 10 weeks.
Exactly.
Right. And after that, you will graduate the surrogate to the care of an OBGYN who will ultimately deliver the baby.
Yes.
Right.
Exactly.
And
right.
also the hospital where the surrogate will give birth. So these are all basically the costs that are associated with it. The magic number that we always use to talk about the costs of surrogacy, we always say somewhere around between $100,000 to $150,000. And that's really to cover everything that we just talked about.
Yeah, and from a clinic perspective, it really depends, because the IVF cycle has its own clinic fees. And then if we're doing chromosome testing, there's an additional fee for chromosome testing that the Genetics Institute will charge. And then there's a fee for screening the egg donor and screening the surrogate. And after our initial consultation, typically we have a Zoom consultation together. We'll review sort of the steps in your journey. And then what I do is I connect you to my team, and my team will be happy to review everything, all the financial aspects in detail with you.
Okay, great. And I think we just had a question come through on someone wanting to know what the pricing is like for chromosome testing.
So typically the chromosome testing costs are somewhere around $4,000.
Okay.
And that's for the PGD, PGS, or?
Exactly right. Now the chromosome testing for chromosomal copy abnormalities, these are for abnormalities such as Down syndrome, monosomies. These are copy abnormalities that are typically related to the quality of the eggs, which are then related to the age of the egg provider, the egg donor. So the risk is much lower when you're working with an egg donor in her 20s, and the risks increase as the patient or the egg provider is older, especially after 35 years of age. Now, there are other genetic tests that sometimes we do on embryos, and that's based on whether the sperm provider and the egg provider share particular mutations, or there's some dominant mutations that we want to test for. Those are going to have higher expenses because we have to create probes specifically for those mutations and then use those probes to analyze those particular mutations. Now, the odds of that happening are much, much less, but the typical chromosome testing is close to about $4,000.
Perfect. And how do you work together to help the patient during the process?
Communication is the key component of taking care of intended parents and patients. So I think both our team and EDSI's team, really, we pride ourselves in communicating, being constant communication, and being constantly available to you. So for example, when we have our first consultation together, I let you know that you can contact me either via email with my medical assistant, Mai, in copy, because Mai has to be copied on all my emails. She collates my email server. And I also provide you with my mobile number, my cell phone number. You can text me if you need to reach me more rapidly or more urgently. So always being available to you and really communicating every step in your journey is what's going to bring you confidence, make you feel comfortable as you move forward. Because this particular journey can be complicated, but I think if you have a great team behind you, it's going to make the journey much smoother. and you'll have a lot more comfort and a lot more confidence as you take the steps towards becoming parents.
And one very important aspect, and the importance of us as agencies communicating with your doctor, is things always come up. You know, as much as we always hope for smooth processes, things will always happen. So you want to make sure that you really have the right team on your side, the best doctor, the best agency, the best surrogate, the best lawyers, so that everybody is communicating and trying to figure out how to solve whatever challenges come up. That is key.
Yeah, absolutely. And Dr. Danishmand, I think you were touching on this earlier, but I'd love to hear a little bit more about what the process looks like from kind of start to finish, what the different steps are. And I guess, if I'm not sure if this is something you could provide, but how long does the process typically take, and when do you hand them over to someone like Parham?
So typically, from the time, I always tell patients, from the time we have our initial consultation to the time where you have your child in your arms is roughly somewhere between 16 to 18 months, including the 9 months of pregnancy. And of course that can vary, because one of the two steps that are important within your journey is finding your egg donor. And for some of you that may take a longer time, for others it may take a shorter period of time, or if you're using your own eggs, then it's a much quicker process. And then of course the wait time to finding the ideal surrogate. You know, EDSI has very strict criteria in regards to surrogates. And so it's going to take some time. Sometimes it can take 3 months, sometimes 6 months, sometimes a little bit longer, but we want the ideal surrogate. The ideal surrogate is someone between 24 and 42 years of age, healthy, no medical problems, previous pregnancies without any complications, somebody who has a good supportive family home structure. We have to review all the medical records for the surrogate. And if the medical records show us that there were no complications and no red flags, then we can move forward with the screening of the surrogate. So it's about somewhere between 16 to 18 months. And during that time, again, both our team and EDSI's team is in constant contact with you, supporting you, giving you the next steps, and being available as we guide you through your journey to becoming parents.
On our end, I think it's important to note that I don't want to waste anybody's time. So I know there might be some agencies where they welcome any woman who wants to be a surrogate into their program. And then they, you know, as they match, then they send them for psychological screening, or, you know, do their medical, physical checkup at least, or a home visit, or whatever else they do or they don't do. I don't want to waste anybody's time. So we make sure that we complete all of these for our surrogates that we're presenting to the intended parents beforehand. So all of the surrogates that we are presenting to our intended parents have already done their criminal background check, their home visit, psychological screening. We also have them do a physical checkup. The fertility checkup is done by your doctor. So the hydrosonogram or suitability of being a surrogate is done, of course, by Dr. Danishmand. But at least we want to make sure that the surrogate is physically healthy. We check the thyroid, we do a pap smear, make sure that they are suitable health-wise to become a surrogate. So those are the things that we focus on beforehand, so that we're not wasting anybody's time.
Great. We have a few questions in the chat. First one is, do children born via surrogacy know about their surrogates?
When you look at psychological studies that have been done, most psychologists agree that it's a good idea at some point in the child's life to discuss how they were conceived and how they came to be in this world. So, and for some children, it could be at 8, 9 years of age. Sometimes it could be sooner. Sometimes it could be 10 to 12 years of age. But I think that it's a sort of an empowering event for children when you have a frank discussion with them in regards to how they were conceived. And to me, most of the parents that I've helped in terms of creating their families, they have these discussions, and in a way, it shows the children how much they were loved and how much they wanted to. Their particular parents wanted them to come to this world and to be their parents. It's really a measure of the love and desire and the passion that the parents had for wanting to become parents, and to the extent that they went through in order to be able to find the ideal surrogate, find the ideal egg donor in order to be able to create the families. I think that it's really an empowering conversation. And when you look at psychological studies done on children born via surrogacy and egg donation, and there have been several that have been published and peer reviewed, you'll look to see that the children born via egg donation and surrogacy, there are no differences in terms of their mental health development, in terms of their school performance, how they assimilate within their peer groups versus other children. So I think it's a great conversation to have. And I think for each child, it could be at a different time. And I think it's a parent's sort of decision as to when they want to start that conversation with their children.
Great. Parham, what's your take on your experience with this?
Well, egg donation, very different from surrogacy, of course. When I started 20 years ago, there were a lot more privacy issues around egg donation specifically. Well, nowadays, in the world of 23andMe, those are all out the window. So the best thing that intended parents can do when they become parents is to have those really age-appropriate, frank conversations with their children. There are so many amazing books that guide them through the conversations that they need to have. A child's story becomes their story, no matter what it is. And how you tell them, that is what they will own, and that's what they will grow up with. And what I always say is there is a huge difference between privacy and shame. There is absolutely no shame in creating a beautiful life, and there should never be any shame that's passed on to a child that would feel like they were born any less or any other way than anybody else has. So their story becomes their story, and the miracle of their being, I think, becomes theirs. So that's very important to share it with the child.
And going off that, how much contact do surrogates and intended parents have during the pregnancy?
Well, it's, for you as an intended parent, this is your pregnancy. So you have a lot of control. You're the one who's actually making all the decisions about what happens during the pregnancy, about the child, the number of embryos that are transferred, what happens in case of genetic abnormalities or issues of abortion, reduction, things that need to be discussed. Post birth, all of the decisions that are made for the child that's born, what shots they get in the hospital, what, whether if it's a boy, whether the boy is going to be circumcised, whatever decision it is you as the intended parent, as the parent, that will be making those decisions. So as far as surrogacy is concerned, there is a lot of communication between you and your surrogate to make sure that everybody's on the same page. With egg donation, it's different. Egg donation, 90% of egg donor cycles, I think, in the United States are mostly anonymous, where the intended parents don't know the identity of the egg donor, and the egg donor doesn't know the identity of the intended parents. However, that doesn't mean that you as an intended parent cannot actually meet your donor. You don't have to exchange identifying information, but I always encourage at least maybe a phone call or a video call or anything that you would be comfortable to see who your donor is, to be able to get a sense of the mannerism of the donor that might be interesting to you when you see certain things in your child in the future. So these are important decisions that need to be made on your part, and you are in control. So you are going to be really be in charge of all these aspects of your egg donation or surrogate.
Okay, great. And diving back to what you mentioned previously, I'd love to hear, how do you feel third-party reproduction has kind of like evolved in recent years? Like, I know, Parham, you're really focused on fostering like a culture where we can have more of an open dialogue on this subject, and it doesn't have to be as taboo as it once was. Do you think that that's changing the way media handles it and the way clients come in and see both of you?
Dr. Daneshmand, I'm curious to, I know you've been doing this for about 20 years or so as well. How have you seen it change?
This is in regards to what aspect of the process?
Just in clients, I guess, having more knowledge on it and being more open
Right.
to the idea of it.
It's not just not just the openness. It's willingness to share, willingness to be open, willingness to get the information. It's the not being not to be following these in secrecy anymore.
Yeah, I think there's definitely a cultural aspect, to your to the answer. Meaning that I think that for some, they like to have sort of more privacy as they go through either the egg donor or the surrogacy journey, and for others, they feel that through sharing, it provides them with more support. They seek out support from friends, from family members, and also I think that. In many parts of the world where we've helped intended parents achieve their goals of creating their families, there are these support groups that have become sort of the norm. Whether it's in Italy, whether it's in France, you have these support groups, and through sharing your journey, the support groups can support one another in terms of everything from insurance, to the clinic, to single versus double embryo transfer. So I do think that when there's a community, and when that community shares with one another their particular journey, there are some advantages, and those advantages are such that the future parents who are starting the journey can gain insight from those who've completed the journey, who have their children, and I think that kind of support we've seen all around the world. It has really benefited many intended parents. But we also respect the privacy wishes of other intended parents who want to sort of have that particular journey private between sort of their inner family, and that has to be respected as well.
I know I see that there are so many amazing questions, both in the Q&A and also in the chats. So I'm excited to answer all the questions that I see.
I actually think you might have to read them, Parham, because as participants, it won't let us access them.
Okay, I'll be happy to. So,
Thank you.
Dr. Danishman, one of the questions here is, how long are frozen embryos good? I'm going to make sure that we can answer that live.
Absolutely. Frozen embryos can remain frozen and be viable and good quality for over 20 years. So with the newest techniques that we have, the vitrification technique, which is this fast freeze technique that has really evolved over the years, we're able to now freeze sperm, eggs, and embryos for a very, very long time. In fact, we had a couple from Australia who had frozen their embryos for 22 years. We thawed the embryos and transferred two, and they have a healthy daughter who's going to be approaching 1 year of age fairly soon. So for a long time, for completing your family.
So I have a question. So technically, if a couple do an egg donor, if they do a cycle and they have, let's say, a few embryos, and they use one in this year, and 20 years later they use another one, are they technically twins? 20 years apart.
Well, they're certainly genetically related,
Yes.
The strict term for a twin is one pregnancy with two gestational sacs and two fetuses. So you can think of them as twins, as some you could think of them as genetically related, as siblings coming to life at different times.
One of the other questions we have here is, can someone be a surrogate for a friend or a family? What is your take on that? And I'll give you mine after you answer it.
I think, we still apply the same strict criteria, whether it's a friend or a family member. I think, that particular, you have to even be more careful when it's a friend or family member, because you have to make sure you follow all the strict guidelines and criteria, including psychological analysis, all the legal aspects of, the contract between the intended parents and surrogate. You may certainly trust your friend, trust your family member, but we don't cut any corners. We still apply the same very strict criteria to the suitability of that particular surrogate, the ability of that surrogate to really have a healthy pregnancy. And I think if the health of the surrogate is protected, if her legal rights are protected, and then it can be a situation where, and we have many intended parents who use a family member or a particular friend as their surrogates, but we just want to make sure that it's done under a sort of an umbrella of legal protection and health protection as well.
And not that every woman who wants to become a surrogate ultimately is suitable to become a surrogate. So that's one of the important things to consider as well.
Exactly.
Here's another question. Is history of miscarriage and pregnancy complications considered in evaluating surrogates? If so, what factors are reviewed?
Well, depending on miscarriages, because miscarriages oftentimes, about 75 to 80% of miscarriages are secondary to chromosomal abnormalities with the embryo. So that is not related in the majority of instances with the health of the uterus and the ability of the surrogate to carry a pregnancy. We have to look at the global picture. We have to look at the total health and all the pregnancies that a surrogate has had. But having miscarriages doesn't disqualify a surrogate. We just have to know how many, what the reasons were. Was this related to the embryo or was it related to the uterus? As patients get older, especially after 35, the risk of miscarriage increases. So if a surrogate is 38 years of age and she's had 1 or 2 miscarriages as a result of the decrease in egg quality that we see with advancing age and the resulting increase in chromosomal abnormalities, then that's okay. That does not disqualify them. We have to look at the total picture of their pregnancy history and make a decision.
One question here is, in what states is surrogacy legal, and what do you recommend for parents that are confused about their state surrogacy laws? Do I need a lawyer? If I may just answer that, when we look at surrogacy laws, it really doesn't matter where the intended parents live. They could live anywhere in the world. It's where the surrogate lives that is the important aspect. So you want to make sure that your surrogate lives in a surrogate-friendly state, because that's ultimately where she's going to be giving birth. Currently, there are many states in the United States where surrogacy is legal. There are only 3 where the surrogacy is not legal. Within the states where surrogacy is legal, there are different types of surrogacy. So it could be that you might be able to get a pre-birth judgment or a post-birth judgment, or that it might require a mini adoption. So there are different aspects. It is absolutely very important, and this is what we do at EDSI, is to introduce you to lawyers who specialize in the world of third-party reproduction, and to make sure that they can guide you through all of the aspects for the specific state where your surrogate lives, and to make sure that the legal processes are completed properly. One of the questions that I always get when I meet with parents is, can I, my cousin's husband is a lawyer, can I just use him? And my short answer is no, unless he really specializes in the world of third-party reproduction. You don't want, I joke with them and I say, you don't want someone who practices real estate law who now want to do a contract for you for surrogacy. It is a, you have to go to court. You have to, you are technically suing your surrogate. It's a friendly lawsuit in which you are declaring to the court that the intent behind creating this life was to make you the parent of the child. So these are all the technical things that must be done properly by a good lawyer. So I hope that answered the question. Here's a question about egg donation. It says, what do you look for? What should one look for when picking the right egg donor agency? Well, like any professional that you want to decide to work with, you want to make sure that, number one, they have the bandwidth to deal with all of the concerns, issues that come up, and that we have the mechanisms in place to be able to guide you through the entire process. In picking an egg donor, in picking your surrogate, it's very important that you work with an agency that has a comfort level with your doctor's office to be able to communicate with them. Ultimately, you want to make sure that we provide your doctor with all of the information they need in order to make the right decision for you. And because Dr. Danishmand is the ultimate arbiter of who will become your egg donor or surrogate, it's important that we as the agency are not wasting his time, that we are not just bringing anybody on. We want to make sure that we know what his criteria are and that we are meeting his criteria, and we're only presenting him with ones that ultimately will be a good egg donor or a good surrogate. Does your clinic perform the psychological evaluation for intended parents prior to starting a journey?
Yeah, so sometimes the agency will perform the psychological analysis for, oh, you're talking about the intended parents.
The intended parents,
intended
right.
parents, we recommend independent psychologists to you. And these days, most of the analysis and most of the interviews are done via Zoom, via video. So we have some great psychologists that we work with, and we'll recommend some to you so that you can have your psychological assessment with them.
It brings up a good point. So for example, within our agency, we don't require the intended parents to have any psychological screening or evaluation. We certainly 100% do for the egg donor, and we do for the surrogate. Strict psychological screening by professionals who focus on third-party reproduction, assisted third-party reproduction. However, we don't, we encourage intended parents to not for screening, but for counseling purposes, because when you embark in the world of egg donation and surrogacy, you want to make sure you're in the correct headspace and that you are emotionally, psychologically ready for all of these aspects of third-party reproduction, all the what ifs that might be concerning you, and have a way to deal with them. But we don't necessarily require screening. I'm wondering, Dr. Danishmand, what your take is on that. Do you require screening for the intended parents or just counseling?
We do require it, and it's one of those sort of criteria that the American Society of Reproductive Medicine has outlined in their sort of guidelines or recommendations for evaluation of surrogates, egg donors, and intended parents. We feel that it's always a great idea to have not only the egg donor and surrogate undergo just psychological evaluation, but just a general psych eval of the intended parents as well, just making sure, ensuring mental health, ensuring, like you said, they're in the right frame of mind as they embark on the journey, because it could be a complicated journey. There are many parties that are involved, so we highly recommend it.
And another question here is, what happens to surplus embryos?
So with extra embryos, there are several options. We have an egg, you can donate your embryos to other intended parents who have trouble conceiving. So we do have an egg or embryo donation program here at San Diego Fertility Center. And you can sort of designate whether those embryos could be donated to couples or single intended parents here in the US, or you would like to just designate outside the US. So you have that right, but there is that embryo donation program that we have, and it's headed by one of our team members, Sherry, and really allows other intended parents to come in and use that embryo donation program in order to be able to achieve their really goal of and dream of becoming parents. For some, that's the only avenue. You can donate those embryos to science if that's your choice, or let them go. So those are the sort of the three options that you have, and it's your purview, it's your choice of what you wish to do.
Another question here is, what type of professionals are involved in the IVG? I think she meant it's a type of IVF and embryo transfer process.
So we have you have your doctor sort of who's the captain of the ship per se, who is really overseeing the entire IVF cycle, the embryo development, the embryo transfer. But we have a team of 12 embryologists, highly skilled embryologists in our lab. And really they are the ones who are performing the fertilization of the eggs, the development of the embryos. And so I work closely with them in order to be able to effectuate the embryo transfer and the IVF cycle. We have a team of nurses, nurse practitioners, physician assistants here who are supporting egg donors, intended parents in their journeys. Then we have a team of medical assistants who are in constant contact with you, who are sort of guiding you from one step to another. So it's an amazing team. We have a team of over 70 professionals here at San Diego Fertility Centers who are really helping you in every step of the process. We have a financial team that's going to look after you in regards to your insurance benefits and in terms of the cost of the IVF cycle. So it's an amazing team of professionals here. And after our initial consultation, I will connect you to them so that they can also provide you information, whether it's the financial aspects, whether it's the IVF cycle. So that's my team, and I can't do what I do without the brilliant work of the team that I work with.
And of course, outside of the fertility specialist's office with the amazing professionals that they have, there are the psychologists, the lawyers, the agency, the OBGYN, even the judge that is going to be stamping the pre-birth judgment. We're blessed to be now living, for example, in California at a time when they have the specific judges assigned to just these cases. So you don't have to go to other judges who don't know the process and they have to learn it now. So it is great to know that we have professionals that are specializing in this third-party reproduction and really helping you become a parent with less hiccups.
Very true.
Yeah. What does the screening process for intended parents look like? Do they have to do any tests to see if they are a good fit for the process or to be a parent?
From a medical perspective,
I don't like the last part, by the way. I think anybody should be a parent.
So the main assessments are the assessment of the sperm and the egg. So if there are intended parents who are using their own eggs, then we want to get an egg quality analysis, an egg count analysis, what we call ovarian reserve testing on the eggs and the ovaries. And then from a sperm side, then what we want to do is get a sperm analysis, look at the different parameters, concentration, motility, morphology. We do genetic recessive mutation screening, making sure that the sperm and the egg have genetic compatibility. Infectious disease testing that we perform for the sperm providers and all the sperm providers and all the egg providers. So there's this diagnostic testing, which is sort of the initial steps, because we want to get an assessment of the gametes, of the sperm and the eggs prior to sort of embarking on the IVF cycle to create the embryos.
And here's another question. Would you ever recommend working with a surrogate outside of an agency? I'll let you answer that.
I think you should take that, Parham.
Well, of course, my answer would be definitely not, but I just want to explain what it means. Of course, there is always that choice that you have to be working with a surrogate independently. The nightmare stories that we hear about. I just did a webinar about maybe 3 months ago with a set of intended parents who had decided to do their independent journey. 3.5 years into trying to find their ideal surrogate, and actually 2 surrogates stealing money from them, they were finally able to find a surrogate on their own. And for the second time, they decided to actually go through an agency. Because there are so many factors when you start looking at who is suitable to become a surrogate, whether they have been a repeat surrogate or a new surrogate. Not all repeat surrogates, by the way, are really suitable to become surrogates again. There is new psychological screening, medical screening, complications that they might have had through their previous pregnancy that would not qualify them to become surrogates again. So the job of the agency is to really save you a lot of time, heartache, and headache, and to make sure that they have someone for you that has already been pre-screened. that you're not wasting a year and a half, 2 years of your time just going through meeting different women who might be amazing women, and they might have the right outlook and they want to become a surrogate, but they might not be suitable, either psychologically or medically be suitable to become a surrogate. So working with an agency, you always navigate all of these more, and also you create a buffer between you and a surrogate. And one of the most important of which is a financial buffer, because you don't ever want to be in that uncomfortable position of having to negotiate when you've already have laid out what the terms are, to be negotiating further. I've heard stories about surrogates who have had sob stories to their parents. Oh, my husband just lost his job and we don't know what to do. And of course they feel bad and they think they need to give support. It's good to have a buffer there who can deal with it more professionally, or also get other professionals involved, like psychologists, that would make it easier to navigate through all of these aspects. I don't know if you want to add anything else to that, Dr. Danishmand.
Yeah, I mean, I agree. I think that in this sort of incredible journey of surrogacy, there are many, many sort of spokes to the wheel of surrogacy. It can be a complicated process. So if you have an amazing team behind you, supporting you and guiding you, yes, does it increase the cost of the surrogacy journey? It does, but it gives you that feeling of comfort and confidence that you are supported by a team of professional and experienced people who are ready, available to you, will support you. And if there are any particular complications or sort of bumps in the road, they're right behind you to support you and help you reach your goal of parenthood.
So I know we're getting towards the end of our time, and I wanted to know, Dr. Danishmand, when it comes to surrogacy, egg donation, screening, intended parents, any last advice that you have for our parents?
I just feel like
make it smoother for themselves.
Absolutely. I just feel like, the more meticulous you are, the better the whole process, the smoother the whole process. Taking a little extra step, taking a little bit more time in the very beginning, making sure that all sort of aspects of screening are in place. Your surrogate has been screened. Sometimes we'll screen a surrogate and her thyroid is marginally abnormal. What we do is we repeat the thyroid examination. Now that may take an extra few weeks, but again, we want to make sure that all the thyroid parameters and all the other parameters are normal before a pregnancy ensues, in order to minimize the chance of complications during pregnancy. So I think being patient with the process and making sure that you are in communication with us, with the agency, in regards to your desires, your wishes, your concerns. Really, I think that makes for the smoothest journey possible. Take your time. We're here. Reach out to us. We're here to give you information, to give you support. We're all very passionate about what we do. We, at the end of the day, when we get pictures on our cell phones and emails of babies being born, babies now 2 years of age, 10, 15, and if you've been practicing as long as Parham and I have been practicing, you have incredible families out there, and you played a part in the creation of those families, and watching those families grow, and the happiness and joy and love that's created. Not only parents but uncles and grandparents. That's inspirational to us. That's our passion. That's what we do, and that's what we love waking up in the morning for and going to work. So we look forward to helping you in this journey, and look forward to meeting you.
That's amazing advice. By the way, I love the fact that more questions are coming in still. So one of the questions here, it's going into, it says, go into more detail about the comprehensive evaluations of a surrogate. For example, in light of COVID, are there home visits to the surrogate's home? Absolutely, yes, we still do home visits. We do them safely. We make sure that we adhere to all of the social distancing, but we do home visit because that is a very important aspect of making sure that they live in a safe, secure, and family-supported environment. Are they required to be vaccinated? That is one of the things that we are, that becomes a part of our matching, because there are intended parents who absolutely want their surrogate to be vaccinated. There are intended parents who don't want their surrogate to be vaccinated. There are surrogates who want to be vaccinated, and there are surrogates that don't want to be vaccinated. So it becomes a part of our, one of the criteria that we always look at to make sure that we have the right match for our intended parents. I'm sure, Dr. Daneshmand, you as a physician, you recommend strongly that the surrogates, the intended parents, that everybody get vaccinated, but not everybody wants to. So how do you do that?
Yeah, I mean, I certainly respect the rights and the wishes of those who don't want to. I just feel that the only way to vanquish this epidemic or this pandemic is really through vaccination. It's a way to sort of support your own health, to support the health of others. But I also am open to listening to those who have concerns about vaccination. Right now, we don't have a criteria that surrogates have to be vaccinated before they qualify to be surrogates. As Parham said very eloquently, you intended parents and surrogates have to be philosophically aligned in terms of this particular question, before they move forward.
And there's another question here is about the partners. So they want to know if there is, the screening for the partner, including psychological screening. I will just quickly just share that the partner, we don't require psychological screening, but there is medical screening that the partner must undergo, which I'm sure you will explain, Dr. Daneshmand.
Absolutely. So the partner, we required a full infectious disease panel on the partner. Many surrogates will actually come in for their screening visits with their partners, which is great because we get a chance to speak to both of them, address their concerns. Their partners it kind of gives us a feeling that the partners are supportive of their partner's desire to help others as a surrogate. And then we do the screening right there for them. For those partners who are not able to come in during the screening, then we have labs that we work with across the country, and we do the full infectious disease panel on the partners as well.
And psychological screening, do you recommend it for? I mean, we don't
require it for partners. We don't require it for partners, but oftentimes the surrogate, will be. I mean, all the time they'll be asked about their significant other, about their partners during their psychological evaluation, about that relationship, about the stability, about any concerns, any fears, if there's any concerns about that, that's going to come up in the psychological examination of the surrogate.
There is a question about what is the total cost. I think we covered the costs and the parameters, but if you have specific questions about the costs, just please reach out to me or reach out to Dr. Daneshmand's team, and I'm sure that they will be able to tell you what the IVF, the medical aspect costs are, and I'll be happy to go over the surrogacy or egg donation portion of the expenses as well.
Thank you guys all for joining. You have everyone's contact information right in front of you. Thank you again, Dr. Daneshmand, and thank you again, Parham, for a lovely webinar series. Take care, everyone.
Thank you so much. Bye, everybody.
I always love seeing you, Dr. Daneshmand, and you're brilliant. So,
oh no, you're very kind, and the feeling's mutual. Thank you.
Thank you. Take care.
Bye.